Hello, I'm Dr. Jabara Swain, cardiovascular surgeon and medical executive at Johnson & Johnson, and I'm here to talk to you about a really important topic. The title of my presentation is Facing the Challenge, Recognizing the Threat and Reducing the Risk of Peripheral Artery Disease in Black Americans. This presentation was designed with three goals in mind. First, we'll share information about peripheral artery disease, or PAD. We'll then discuss why it's important for Black Americans to understand about PAD. Then we hope to help give you information about what you can do to keep yourself, your family, and your community healthy and avoid the consequences of peripheral artery disease. Black Americans are more than twice as likely to have PAD or peripheral artery disease than white Americans. It is important as you understand this statistic to know foundationally what is peripheral artery disease. Let's start with the basics. Arteries carry blood through your body. And plaque is made up of fat and cholesterol that can build up in your arteries and can cause a blockage. Peripheral artery disease occurs when plaque buildup forms in the walls of the arteries that supply blood to your limbs, and that usually occurs in your legs. When this happens in your limbs, it's called peripheral artery disease, or PAD. If you have peripheral artery disease, you may also have blockages in other parts of your body. Two organs that commonly have blockages include the heart and the brain. Blocked arteries can mean greater risk for heart attack, stroke, or amputation. A heart attack occurs when a blockage occurs in the arteries of the heart, and a stroke can be caused by a blockage in the arteries going to your brain. There are a number of different diseases and conditions that could put you at greater risk of developing peripheral artery disease. They include diabetes. Patients with diabetes, particularly those who are over the age of 50, have a 1 in 3 chance of developing peripheral artery disease. Also, if you have heart disease, you have a 1 in 3 chance of also having peripheral artery disease. High blood pressure is a significant risk factor. So is high cholesterol and being obese or overweight. Other conditions that can put you at greater risk of developing peripheral artery disease include having chronic kidney disease, smoking, having a family history of peripheral artery disease, being older in age, and if you're Black American. There are important signs and symptoms for peripheral artery disease that we have to be conscientious of. However, remember, about 40% of patients will not have leg pain associated with their peripheral artery disease. So it's really important to understand how to recognize the different signs and symptoms. Painful leg cramping can occur. You can also have numbness, weakness, or heaviness in your legs or feet, breast pain, cold feet, discolored skin, hair loss in the arms or legs, and foot sores. These are all conditions that can occur, or rather signs and symptoms that can give you clues that you may have peripheral artery disease. Treating peripheral artery disease in time may protect you from serious medical consequences, which could include amputation, such as loss of leg or foot, heart attack or stroke, and even death from heart attack or stroke. Untreated peripheral artery disease can affect your activities of daily living and impact those around you. There are a number of tests and screens that we as providers can offer our patients to help understand whether or not you are either at risk of developing peripheral artery disease or if you have active disease. However, the most important thing as a patient is to tell your doctor if anyone in your family has or has ever had peripheral artery disease. Then, anytime you see a provider, make sure you take your shoes and socks off and insist that they examine your legs and feet. Your doctor should take your blood pressure in your ankle as well as in your arm if there is concern that you could be at risk. Other tests are also available to help diagnose peripheral artery disease. And even with that, your doctor may need more information and they may do additional tests, which include blood tests, ultrasound, and medical imaging. If you have any of these signs, be sure to alert your provider. And they include wounds on your toes, feet, and legs that are slow to heal, unexplained pain or cramping, skin discoloration in the feet, poor nail growth, skin that appears shiny, and loss of leg hair. Again, about 40% of people with PAD do not have leg pain. Your doctor may recommend medications that can help reduce your risk of complications from peripheral artery disease. And those medications can help lower your high blood pressure, lower cholesterol, prevent blood clots, and help ease leg pain to improve your ability to walk or ambulate. And so now that we understand peripheral artery disease, there are a few key factors that we can evaluate that will help us to reduce our risk. Let's be more active. Walking and or getting exercise is important. A doctor or physical therapist can help develop a plan that will work for your specific needs. Quitting smoking. Your doctor may be able to recommend specific plans to help quit. Eating a heart-healthy diet is always encouraged. And taking good care of your feet. Wearing properly fitted shoes. Consult a foot doctor for corns, bunions, and calluses, as well as fungal infections, such as athlete's foot. And get checked regularly by your doctor. Don't risk stroke, loss of limb, or even death by getting screened for peripheral artery disease. If you think you or your family member may have PAD, schedule an appointment now. There are a number of different resources available. Some websites include those that are hosted by the American Heart Association, the National Heart, Lung, and Blood Institute of the National Institutes of Health, the American Diabetes Association, the American College of Cardiology, Partnerships to Advance Cardiovascular Health, Vascular Cures, The Way to My Heart, and National American Thrombosis Forum. Johnson & Johnson also has a host of resources available, as well as their website, SaveLegsChangeLives.com. A number of advocacy organizations host resources that are available and free to the public. And then there are online resources that can help you quit smoking. Thank you for your time, and I hope we've helped you to understand better why it's important to avoid and to be able to minimize your risk for developing peripheral artery disease.